Welcome back to Go Ask a Nurse, where we dive into real conversations with professionals who are changing healthcare with compassion, knowledge, and innovation. I'm your host, Anna Marie, a nurse, an educator, and an advocate for empowering patients to take charge of their health. Today, we are thrilled to explore the healing power of functional medicine with Dr. Seema Patel, a leader in blending personalized medicine and holistic healing. Thank you so much, Dr. Patel, for being here. I am so excited for this conversation. So for those that are unfamiliar, can you explain what kind of functional medicine is about and how it differs from traditional healthcare?
Yeah, so, everyone knows when you go the traditional approach where you go in, you have a set of symptoms, like I feel blah, 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 blah. And the physician listens to you and they give you a pill, they give you a procedure, they send you to a specialist who will also give you a pill or a procedure or some combination of that. And it really pays no attention to diet or lifestyle. Outside of, eat better, exercise more, sleep more. It's just very casual addressing of that. And it's very focused on what they consider as preventative is doing a mammogram, doing a colonoscopy, which I agree. Those are all great things, but that's not really preventative. Preventative is sort of how functional medicine does it, where what is the foundation that is supporting this person? And that foundation is really in the roots of your life. And so that is, how are you sleeping? What are you eating every single day? Are you nourishing your body or are you just eating because it's fun to eat? What's your stress? What are your relationships with people? Because some people can be very toxic and other people can be very rejuvenating to somebody. And then what's the movement? Those are the foundational pieces that put somebody together. We also understand that people are very biochemically different. Traditional medicine has become an algorithmic sort of, you have high blood pressure, do this. You have this, do that. And you just kind of follow. And it's really great when people are, especially when we have advanced practice providers who may not have as in-depth training to help guide them. But once again, there's no individuality to that. That's all taken out. And functional medicine is 100% personalized to what you want to do. And the most important thing is we look at what is the root cause of why you got sick, right? So we're going upstream to figure out when did this happen. So that means taking a timeline of like when you were first conceived to where you are right now and what happened during this time period. Because think of it this way, by the time most people come to me as a physician, my patients are relatively sick. They're not, I'm just here to get optimized. I do get those patients, but the vast majority are dealing with something. So I always explain to them, we're going to start with, when was the last time you were well? We're like, well on a regular basis. They're like no problems? I'm like, no problems. They're like, oh my God, that's like decades ago. And that's usually where we start the story and we start building, and you can see like, they had stress, they had an accident, they had surgery, they had tons of antibiotics, they moved, they were surrounded by this toxic equipment. As you take that history and they can see themselves, they're like, oh, yeah, that's probably not good for me, right? And then it's also what happened as a child, because this is when your microbiome really develops. And it's surprising how many people have been on steroids and antibiotics. And really when the child's gut is developing, we've wiped it out. And we just assume it's going to grow back. And I can't say that's what I see. I just don't see it just growing back. I see for my young children just a total lack of beneficial bacteria. It's like a desert in their microbiome, but it should be a rainforest. So it's really about a root cause, but going back through time to understand how many hits they took and that bucket of what their body could tolerate, how full it's become. When it's overfilled, they have lots of symptoms. When they're near the top, they got diseases. When they're kind of feeling pretty well, that bucket's on the lower end. So our goal is to empty that bucket of everything that's happened to them. We're opening up Pandora's box, which nobody wants to do in traditional medicine.
Wow. How long do your appointments last? That just seems like a lot of information to dive in, because it's like counseling, like really counseling and diving into their whole history to kind of understand their whole background. And
so we have a pretty extensive form. We're not even going to lie about that. Our our form is pretty extensive because it starts with, how old were your parents when they had you? And they're like, what kind of complications did your mom have? And a lot of times, say people who are older, they have no idea. But we start, I've already gathered information, but I really try to start the story in my 1 hour interview. I have patients who spend 2 hours because, they know they're complicated and they're like, please give me the 2 hours. Cause I just want to, it's very cathartic to talk through your entire life about somebody who can put it together in a different form. And I find that telling the story and then having me summarize the story back to them and then showing them sort of the insults and sort of the root causes of what happened just from their story, there's this light bulb that goes out like, I need to live my life differently. It doesn't mean it's better, but it's differently. I'm not saying traditional medicine is bad in any ways. We need it. Anything acutely happens, it is the best thing on the planet. When it comes to chronic disease, not so much. We don't really have any solutions. We have pills and we have procedures. But the question people always ask me is like, can I come off of the stuff that I'm on? And I'm like, it just depends on what happens and how much we can do and what we can get rid of and what we can fix and what we can bring back to balance. The best time to see somebody is when you first get diagnosed with something or when you're feeling icky because you don't even have a disease yet. We can make you feel better. But oftentimes when you're a physician in functional medicine, people come and they're like, I've had MS now for 20 years. I'm like, okay. So it's, this is my third cancer. I mean, I can help them, but it's not like, I don't feel good. Something's not right. That person, we can make a lot of improvement on because the further you get down along the disease process, the harder and harder it becomes to bring everything back and to fix everything and to be able to come off of medications. And so I have to have this honest conversation about, if somebody's promising you that they can do that, then you should go see them because I will not promise you that. I don't make any promises to anybody. I'm not the doctor of last resort. There are many, many incredible people out there. I do my best work. And if I don't know the answer, I tell them. And I tell them if they need to go see somebody else. Because there's things outside of my wheelhouse. Like I'm not deep into cancer care. Like if you have active cancer, if you have tick-borne illnesses, if you have dementia, there are people that's all they specialize in. And so oftentimes I'll do the groundwork for that person. So when you go in, everything's already been done so they can assess it and come up with another plan or we'll co-share this patient. So I know where my limits are. And I think that's actually really important. What I find, Anne-Marie, is that there are many people out there with far less education than me, I would have to say, that are overstepping. They think they can treat everything. And I can tell you, at the Cleveland Clinic, we saw some of the sickest, most severely ill patients, even Mark Hyman and Patrick Kenway, like these big names of functional medicine, like these patients are hard. They were like, we saw them. And care was not great because we could only see them twice a year. So that's not really good care for someone who's very, very ill. But we were so busy with a 3,000 person wait list that it was difficult to provide the kind of care you need to. So like in my private practice, it just depends on how sick somebody is, right? If somebody's more sick, we see them more often. If they're less sick, once they kind of got this, like, okay, I got this. I'm going to do this next thing. I'll come back in a couple months and we'll reassess. It just depends. And I see a lot of kids, so that's always a little bit more challenging because, you can't force a kid to do stuff. So I always tell my mom, give yourself grace. We're aiming for progress, not perfection. So give yourself a couple months and then we'll check back in to see how you're doing. Because we know you're not going to be 100%. I know that. I don't even expect that. So don't expect that of yourself. So that really takes the stress off of the parent, the mom especially. You know this. You're a mom. I'm a mom. Okay.
Well,
perfection is everything.
I know. I just was talking to my daughter. She's now driving, and she was going to go. It's Friday, so she's picking up a friend and going to. I don't want to say where she was going, but it wasn't an approved place that I would approve for her to go. I'm like, why are you going to go indulge in all that sugar? And she's like, Mom, I'm a kid. Okay. So yes, you're a kid, right? We say, yeah, you are a kid. I want you to be a kid, but it's kind of like the knowledge of what we know now. If I knew that as a kid, I would have definitely treated my body a lot different. And I know we're resilient, but what we do to our bodies as kids affects us later on in life. And what we do to our bodies now is going to affect us as we continue to age. Would you agree?
Yep, 100%. Yeah, you can use food as medicine to heal your body, or food as medicine, food to fight disease, and food to feed disease. You can choose.
That's a great quote. What inspired you to focus your career on functional medicine and start healing family functional medicine?
I'm boarded in family practice, and I did regular medicine for some time. But to be totally honest, I was assaulted by a patient, and I was like, I walked out that day and I never went back. And I'm like, I'm done doing regular medicine. These patients are crazy. I'm never doing it again. So I had opened up my integrative medicine practice. It was just the universe. It was very traumatic when it happened. But at the end, when I look back, I'm like, the universe wanted me to make a change. I was putzing around, not making that change. So they're like, we're going to intervene to make you make that change. So as traumatic as that was, I'm very grateful that I went down the integrative route, which is where you and I met in Philadelphia. I had a med spa and a whole wellness practice where I really focused more on integrative medicine and hormone replacement, weight loss. So really about like what we talked about earlier on, these patients were not sick. They just kind of wanted to get optimized. They were having some symptoms. And really for them, it was changing their diet, getting their stress managed, working on movement, and then giving a hormone replacement, some key vitamins, and that was sufficient for them. They did really, really well. And it was like fun practice because at the cosmetic end, people wanted to come in and wanted to look great. So it was like a fun practice. But then my husband moved to Cleveland, and I met Mark Hyman before I even started working. And he's like, you need to do functional medicine. And so he explained the benefits of functional medicine. It was really pleasant of him to do that for me. It was like a random place that I met him, and we had this whole conversation. So I started my functional medicine training, and then I joined the Cleveland Clinic. So it was kind of a long and winding route. But to be totally honest, I think I looked for functional medicine my entire professional life, and I just didn't know what it was. To look for a root cause of why somebody is sick. There is no one root cause. There are causettes. So I always have to explain that because people hear root cause and they think it's one thing. And I'm like, no, it's like two really big categories like toxins and microbiome, and then lots of subsequent dysfunctions that can happen with vitamin levels, with food sensitivities, with hormones, with stress, with trauma, with sleep, with lifestyle. All of those are it's everything. They're all interconnected. And I love that it's interconnected. And patients who come in are very different than primary care patients. These patients are motivated. They're not perfect. So I'm not going to tell you like they do everything, but they want to feel better and they know they have to work hard. The difference in primary care was like, give me a pill, doc. Just give me a pill. And so that person would not have done functional medicine. And so I'm very aware that part of the difference between a functional medicine patient and a conventional patient is the functional medicine patient is one who wants to do something different. They want to look beyond what is being given. So oftentimes when we were at the clinic, people wanted to do research with us all the time because they loved the patient population. Like, these guys are so motivated. And, we have our patients are totally not motivated. We have to remind them to take their pills. I mean, you guys are like giving them like 10 supplements and they're like taking them all down, So I'm very grateful to have that patient because it does make your life so much easier. For someone who wants to help somebody, if someone just doesn't want to help themselves, kind of makes your job very hard because then you have to keep presenting it to them like why you should think about changing, right? That was difficult for me. I was not that good at that. I'm much better at I'm ready to make a change. I'm not ready to make that change, but I can work with that.
Well, your demeanor and just by knowing you're a very patient person. So when someone is going to come in And some are just going to, be on board and gung ho and want to make changes. Some are going to do it slowly. And then I think you could probably weed out those that may not even make those changes. But I'm sure they're not going to come see you if they're not willing to try. Right.
Right.
So how do you create a personalized health plan for your patients, and why is personalization so important? I know you kind of touched on this earlier as you were talking about how each of your patients are so different.
Right. So when we do that timeline, we can see what insults happen to them, right? So you can see that this person had a lot of antibiotics. This person had a lot of surgeries. This person was exposed to toxic mold. This person was close to that East Palestine derailment of chemicals. So you're starting to put together what happened to this person. And once you then you figure out, like, my most important thing is I always work on the gut first. They got to be pooping every day. They can't be having gas, bloating, belly pain, reflux. Like, no, they're like, you're not supposed to have any of these symptoms. I'm like, no. They're like, really? I'm like, oh, well, I guess I need some help, right? Because most people just don't poop long snakes every day. They're like, is that what it's supposed to look like? So there's this whole education of, like, what a normal poop should look like. And we really focus on the gut first. And what we want to figure out is, do they have small intestinal bacterial overgrowth, SIBO, or they got a lower gut problem? Because the diets are very different. And diets in functional medicine are not long-term. They are specifically to address problems happening to somebody. There are many, many forms of diets. And so in integrative medicine, they just do anti-inflammatory and that's it. So in functional medicine, we have low FODMAP, low histamine, autoimmune paleo, we have elimination, we have food sensitivities, we have food allergies, so there's lots of high fat, keto, there's so many diets, because diets can be therapeutic. And then there's sort of one that we sort of just do once you've kind of figured out what's wrong with your gut. So we start with the gut, heal the gut, figure out by blood work, what are they missing? What key vitamins are they missing? And then depending on what they told me, then the next question is really, what functional medicine kit do I need to do? Do I need to take a deeper dive into their gut? Do I need to be looking for toxin exposure, like heavy metals, mold? I live in Northeast Ohio. It is cold, wet, and damp here. It is full of mold. It is full of mold. That's all I can say. I can't speak of any other place. But we have seen this huge increase in mold exposure and mold toxicity. And you can see it in the literature. It started around 2000 when the cell phone towers started coming up. This 5G, this EMF that's being emitted from this 5G tower really threatens mold. And I think it just goes into hyper production. And once it's inside the body, there's no natural predator. And if you live in kind of an older school building, older dorm, we have a lot of old buildings here. So it's like a big problem. So I see a lot of that.
So by seeing a lot of that, are you seeing a lot more people who are higher rates of cancer? Are you seeing what kind of diagnosis are you seeing more of due to that kind of environment?
So the people, so this is a really good question, Emery, because it kind of depends on how long you've had the mold. So the people I'm seeing are the ones who are symptomatic. They're in mold or have been surrounded by mold in the past and feel high histamine issues. So they're anxious, they have reflux, they have brain fog, they're fatigued, they have aches, they have pains, they have neuropathy, and heat intolerance. So they're like, something's wrong, right? The ones I don't see are their family members or their family members who think they're crazy and I have no symptoms. I don't see those people. If that sick person can convince their whole family to detoxify, then they kind of detoxify. But the person who gets symptomatic with mold, if we put 100 people in a room, the scary thing is only 20 are going to be symptomatic. Another 20 might have some symptoms, like when they go in and they're like, oh, so good, right? But then they leave and they're fine. 60% have no symptoms. And so they think all these other people are crazy. But when I look at my cognitive defect patients, my multiple sclerosis, my Parkinson's, my cancer patients, I'm batting about 99% all had mold. So they have no symptoms when the exposure comes. So they don't do anything. And then life happens, and then they get exposed, then they get a disease. And then I'm doing the back end work trying to figure out, like, what caused this? And so the microbiome was not healthy, and then also they had mold. And then they had all the other. And each time they took a hit, the mold burden became greater and greater. The less diverse the microbiome became, the stronger the mold became. The less vitamins that they had, the stronger the mold became. The less hormones they had, the stronger the mold became. Because all of these things help control bad things. Your body lives in balance. Just because it has an exposure doesn't mean that you're going to get sick. As long as it's balanced by everything else, a lot of times we can live in tolerance to it. But there will come a time, because we all age, we all have things that happen to us, that balance goes away. And all of a sudden that burden becomes much greater. Does that make sense?
Yeah, absolutely. Well, I mean, because when we're talking about MS and Parkinson's, and I can't really speak much to cancer, but you have those autoimmune things, and something has to something sets it off. Sorry, right. As I'm not talking correctly.
Autoimmune is like the biggest one with mold, like all this JIA for kids and Crohn's. It's all mold. It's like incredible. And the microbiome. Those two are like probably the two biggest root causes. And I really believe everything else is subsequent dysfunction. Autoimmune is huge. So I'm sorry I didn't talk about that, but that's my greatest pediatric population. It's so sad seeing all these young kids with an autoimmune disease. Like, it's devastating to me.
Mm-hmm. And probably COVID didn't help. I mean, you probably saw a lot more.
So, what's interesting, we definitely believe, COVID, the vaccines, there's immune dysregulation. These people with post-COVID vaccine injuries have immune dysregulation. They just have immune dysregulation. Some people are just thinking this is just spike protein. I just sort of feel like that's just not spike protein. I think your bucket got filled with many other things. And this was the trigger. This was like, took you off to the end. And so those are the patients where I did a lot of work with post-COVID patients at the clinic. But in private practice, a lot of patients come in and they want to know if I'm going to do everything about the spike protein. And I would just have to say, that's not me. I'm going to look at everything else and the spike protein and work on decreasing that total body burden. But patients who just believe this is the only injury, I'm not the right fit for them. There are people, they've been on Fox News, that they believe this is it, and you should just go see them. I take a very functional medicine approach. Like, I have a chronic fatigue patient. We got to look at everything, because whatever happened were multiple insults that kept happening to you. Because, when you have post-COVID, you've got mitochondrial dysfunction, you've got recurrent viruses, persistent viral activation, you have microbiome issues, you have mast cell issues, you have I'm missing something else. You have immune dysfunction, you have nerve damage, and you have microclots. You have lots of things happening. But it's just not COVID. COVID just triggered it all. Mm-hmm. So I think that's sort of where my approach is slightly different than some other people. So that's why I have a conversation with everybody before, just to see if I'm the right fit for them, but also am I a good fit for, am I what they want? Right? Sometimes I'm just not, then I don't have a problem with that.
Your clinic integrates lifestyle strategies, nutritional counseling, hormone balancing, gut healing, and detoxification. Can you walk us through how these elements fit together in your practice, which I think you've kind of talked about?
Yeah, think about it this way. What happens to us first is we have genetics. We're predisposed to getting something. Most of us are, right? But at the end of life, it's about 10 to 15% for most of us. But 85% of everything that happens to us, 80%, is really environment. And environment washes over your genes, turning on and off gene expression. So in the environment, what are the things that affect us? Stress and trauma. If you're constantly stressed, you've had traumatic episodes, your cortisol is really high. That increases inflammation everywhere. But chronic cortisol puts on weight, but it also starts to kill your healthy microbiome. The good guys, they just can't handle that kind of stress. That's not how we evolved. We evolved just running away from something and then relaxing like animals do, right? This constant, I got the mortgage, I got kids, I got this chronic stress. Our body did not evolve for us. And so that really takes an impact on the microbiome. So the next one is, what else impacts the microbiome? What are you eating? How many antibiotics? How many steroids? How many Advils or Motrins or proton pump inhibitors or chemotherapy drugs or other medications are you taking that can affect the microbiome? Because as you decrease the beneficial bacteria, decrease the ability to make vitamins, decrease the ability to digest and absorb, and then that affects vitamin levels. Your vitamin levels start to tank. And they'll say, oh, it's normal, but normal can be an A to a D range. And you could be in the D and it's still normal. I always tell my patients, we're aiming for A. All right.
Mm-hmm.
I'll be B. I'm not aiming for D or C. All right. So we just need to figure out where you feel better at, B or A. And then people can develop food sensitivities, because if your microbiome is hurt, you eat things, especially our agriculture system is not healthy, we can develop foods that just cause more inflammation. That can cause, all of those things can cause hormone imbalances. Your thyroid can be off, your adrenals can be off, your sex hormones can be off, just also depending on age. And then the very last thing above all of that is your exposure to toxins. So that's environmental toxins, the forever chemicals, the plastics, the parabens, the phthalates. I mean, these are all, they're everywhere, right? Then we're talking about mold. Then we're talking about chronic viruses. So chronic mono, chronic CMV, chronic parvovirus, hepatitis, and COVID. Then we talk about, could it be a tick-borne illness? I mean, in Northeast United States, tick-borne illnesses are really, really common. It's everywhere. And as global warming occurs, these ticks don't die because the winter kind of kills off a lot of bugs. But if we don't have that, the bug population that becomes hurtful for humans starts to multiply. And then heavy metals, all of those things cause inflammation. And if inflammation is not treated, that goes on and causes the end stage of cancer and heart disease and dementia and multiple sclerosis and autoimmune. But it also causes a leaky gut. And that means that the lining of the gut got hurt. And when the lining gets hurt, things leak out. When they leak out, they land someplace. And wherever they land, that person gets a localized inflammatory reaction. And in your gut, they get diarrhea, constipation, bloating, reflux, burning, some kind of gut issue. Laying in your joints, you get joint pain. Laying in your muscles, you get muscle pain. Laying in your sinuses, sinus pain. Go to your head, you get headaches. Cross the blood-brain barrier, fatigue, brain fog, anxiety, depression, cognitive defects.
All from our gut. And that is like...
Right. So what we want to do is get the gut stronger and then start to figure out where did we settle down? Like, because then people will be like, okay, I feel still lousy, but I feel better here. And now my elbow really hurts and I still have the brain fog. I'm like, okay, so now I know where I need to focus, because they come in like, I have everything. It makes it a little bit hard because you're like, okay, let me just kind of clean some stuff up and see what happens, see what they can tolerate and what their sensitivity is. And that's how we put people back together. It's a process. The sicker they are, the longer it takes. The less sick they are, it doesn't take that long. And people, the good thing at Emory is that most people do not cave back into their old ways because
they feel so good.
They go and they cheat and they do this for a week or two and they're like, oh God, I don't want to go back there. So they just don't. And that whole concept of I'm either feeding disease or I'm fighting disease really helps them, because they're like, I know I felt bad when I OD'd on pizza and beer. So I'll do that occasionally, but I'm not going to do that often. But and when they make those decisions, they are empowering themselves to make better choices. I can't make that decision for them. I can just advise them, and their primary care doctors advise them the same thing. Don't eat that crap, right? But it doesn't come with an understanding of why you shouldn't eat that. Once you explain to them why, and they see the process, and they do the process, so because we take the food out and then we have them put it back in, they're like, oh, look at that. pizza and beef makes me feel bad. So this light bulb of just like owning that information is really important to them. Or like people who are like, I don't have any symptoms, so I get their blood work. I'm like, we're going to get your blood work baseline. And then after your elimination diet, we're going to get your blood work again. And all the numbers will come down and they'll add everything back in because they want to eat everything. We're like, no, I didn't have any problems. Just none. And then we'll do your blood work afterwards. And the blood work goes bad again. And I'm like, you know what? I don't think you're being honest because your blood work changed. You really want to eat this food, and it's okay to feel that way. But you're eating something that your body's 100% not happy about. And when they see that very objective, like I ate better, everything got better, I put it all back, and my numbers got worse, there's some reconciling to do. And I kind of let them sit there for a while, and they're like, yeah, okay, beef and they start having that conversation like, oh, I think it's this, and I think it's this. So I love that. They have to want to do it, right? But I know now where their weaknesses are because I've done this enough times. I've done this for 12 years now, right? So I'm like, okay, we're going to check this in 25 years of doing integrative medicine. I'm checking the blood work.
Well, you give them all the tools, and in the end, it's the patient that has to make those choices, and that's all you can do, right? You can give them the tools, you can be their cheerleader, and they have to make those choices. So it's, I know we've talked a lot about, the gut health and how important it is. Like, what is one thing that you could do for your gut to help heal it?
Eat probiotic and prebiotic foods every single day. So ancient cultures, I'm Indian American, whether you're Chinese, Japanese, Korean, Middle Eastern, with meals, you had prebiotic and probiotic foods. So my father grew up in a small village where, they didn't have a lot of money, but they had just a simple non-gluten made out of millet bread with lots of seeds and leafy greens. And then they had what they call achar, which is a pickled vegetable. And then on the side, you had the fresh milk from the cow that was sitting right outside, and they make it into a kefir. So you got a prebiotic through the kefir and a prebiotic through that pickled vegetable. And this is at every meal, right? Americans, this is, we eat fast food. We eat meat, potatoes, and vegetable. Well, meat, potatoes, starch. That's it, right? Because you need to understand, and this is a part of the explanation, is Americans don't have a culture, right? America was started about 250 years ago, and it became rapidly a capitalistic culture. So it's all about how we can make money. So there was no culture or tradition that was embedded in to say, how do we make you healthy? Like ancient Chinese cultures, Ayurveda did, because it was all about how do we keep people healthy? There's no culture to that. Even in the Mediterranean cultures, there's this how do we keep you healthy approach that's embedded through traditions. But because we became capitalistic very quickly, that shifted. And a lot of this really happened with World War II. We didn't have a lot of fast food before then. But what was happening is when we were conscripting men to join the armed forces, they were too skinny. They were undernourished because people were starving. It was the Great Depression. So the government asked companies to make food to feed them. And that's how the fast food industry, fast processed culture started. And then it just became this billion-dollar industry when we're now addicted. So if you look at the origins, it came out trying to help us, but it took off into a totally different direction. And so now, trying to teach people, where do you come from? So the microbiome is the mother's microbiome. Everybody comes through the vaginal canal, and it's the mother. The father has nothing to do with the microbiome. Understanding where your people, your maternal people came from, Anne-Marie, your mother's people only, following that genetic line up your mother's side only, the women, and you go back 400 years, that is what your microbiome was eating on a regular basis. Because that's when, we didn't move around and travel. It was far to go 10 miles. You're like, oh, wow, 10 miles. It was really far back then because you had to walk. There was no car. Not everybody had a horse. 10 miles is a long walk.
I'm a little nervous about this younger generation because everything is so motorized. And, my husband and I go for a walk after we eat dinner at night, since it's nicer out and lighter out. We'll go for a walk, and these kids are out and about on a motorized bike or a motorized scooter. And you're like, where is the exercise?
Exactly. They're outside, yay, I'll give you that. But where's the exercise? 100%. And, they're playing video games, they're watching TV. So I love when people are doing high school sports, because that's 2 hours of their life where they're outside and they're not on their phone, right?
Right.
Then they got home and then they got to do their work. So that's another 2 hours of their life. And so they do get time, but the time is really restricted. So I really encourage extracurricular activities, because this is one of the ways as parents, we decrease the amount of time they spend on computers. Because if they're not in any extracurricular activities, there's a lot of computer time and phone time and iPad time or whatever,
And it leads to other issues that we won't get into. That'll be a whole other conversation when it comes to mental health.
Yeah.
What are some simple steps people can take today to start incorporating functional medicine principles into their lives?
So get an air purifier for your house. I'm a big believer in that. So whether you put it inside of your HVAC system or you get an air purifier for at least your kid's bedroom if you don't want to spend it on yourself. Highly believe it. So you want clean air, clean water. So, reverse osmosis is very expensive. And if this is not your forever home, that's not an option. But just those gravitational water filters that you just put on the counter. So I have a Berkey. You do not trust the local company. I'm sorry. I live in Cleveland. It's all old. There's probably heavy metals in place. And use clean products. Make sure all of these products are void of all the stuff that's killing us. Okay, so try to do everything with baking soda and vinegar. Try to keep it clean. No fragrances in the house. Keep everything clean, because these kids have a lot more exposures. And then eat as clean as possible. If you can afford organic, try. If not, eat organic from the Dirty Dozen, from the Environmental Working Group. These are the 12 fruits and vegetables that have the most amount of pesticides. Don't buy them in any other form outside of organic. So that's those are like, really, if you can just have clean air, clean water, clean food, you are still 50% ahead of everybody else. That just takes out all the processed food right there, because none of that stuff is clean.
And that's what they tend to give our kids in the schools, is all processed food in their cafeterias.
It's ridiculous. I know. We as parents have to do something, but big multinational corporations have taken over the food industry. It's disgusting. So go find a local farmer. There are farm-to-school programs. They're very difficult, but there are definitely a lot of farm-to-school programs. We have like 3 school districts that do have that here. It was very difficult to get the funding and to set it up, but they do exist. It's complicated, but it is something that you can do.
For someone feeling overwhelmed about how to start, how would you advise them to begin their healing journey?
I would ask them, what is the most important thing you want to work on? And they usually say stress or sleep. So I would say, let's do sleep first.
That's really important.
Okay, stress is complicated, right? Can't always control the stress. But sleep, I will work on sleep. So getting a regular sleep schedule, and really for my women, when I say 7 hours of sleep, that means you have to be in bed for 8 hours. And they're like, what? I'm like, yeah. Because you don't sleep. When you go to bed for 7 hours, you only sleep 6, maybe 5.5 hours, because it takes 15, 20 minutes to fall asleep, 15, 20 minutes of moving around. Then you get up and pee. It's an hour right there. So you really need 8 hours in bed. So we try to make up that schedule. And then respect the circadian rhythm. So the circadian rhythm is an evolutionary process where each cell in your body, it revolves with the sun. When the sun rises and when the sun sets. So we want to arise with the sun and set with the sun. Clearly sometimes you can't go to sleep at 6 o'clock at night. And that's not what I'm asking, but we really want to try to respect that. So people have sleep problems. What we want to do is when you wake up, I want you to see the sun at the same time every day, outside, unfiltered, no sunglasses, for 10 minutes. And then as the sun is setting, go outside once again and see the sun. But why can't I watch it from my window? Because the window, the UV lights are different. Mm-hmm. And your body is responding to those sun rays. So it's really important because that sets the melatonin drive. And they keep the lights lower, no iPad, no phone. I'm like, oh my God. And so they're like, oh my God, I don't want to wear these. So then what you could do, they're like, people who have to wear it, I'm like, you need to do some invest. You need to invest in some money. So I am going to pull out my Eva rays. So I have these, I bought them for my husband and he didn't use them, but they block everything and everything turns orange. Like right now, everything is orange. And it blocks the blue light, so then it doesn't affect, that blue light stimulates you. Mm-hmm. Everything is blocked, so then you can sleep better. Because if you have enough melatonin, you've been sending this message that, I'm not getting this blue light, you'll get more sleepy. If you have an iPhone and a higher end iPhone, if you click your thing 3 times, you put the color filter on and you can put it on black and white. Most people are like, I don't want to look at it in black and white. But guess what? Black and white is super boring and you won't be excited by it. but it won't stimulate you like color does.
Mm-hmm. Do you recommend like a certain time where you stop drinking water so then you're not up in the middle of the night that interrupts your sleep?
Yes, for my women, it's usually about 2 to 3 hours before bed. And also stop eating 2 to 3 hours before bed. Because you need time to digest, because you can't go to bed on a full tummy. Okay, kids are different, but for women, this is for men too. Yeah. I think if you could just work in magnesium, it's amazing. Yeah, taking magnesium for sleep.
Are there any common misconceptions about functional medicine you'd like to clear up?
That we are all totally anti-vaccine, and I'm not anti-vaccine. I'm sort of in the middle. I do think vaccines have really helped us. I don't like the COVID vaccine, I'll be very honest. But if you look at polio, I'm old enough where I remember seeing people 10, 15 years older than me who had polio and were on crutches. Like these young people just don't remember that. So I'm not anti-vaccine. A lot in the community are. What I always tell my patients is, look, there are things that can protect us. I think we're doing too many right now. And I think a slower schedule, a more gradual schedule is really important. And that we prep the body and we detox the body. So for me, that's probably like the biggest question I get from the community that calls me. It might be different for other people, but they always want to know my vaccine status, my vaccine place. And I'm like, I'm kind of in the middle. And so I don't know if that makes them happy or sad, but I'm like, it's individualized. It's totally 100% individualized. And since I do see a lot of kids, I give the schedule as a much slower schedule. Some are like, well, I'm just not going to vaccinate my kids. And I'm like, these are all personal decisions. Whatever you decide, you decide. But I need to have Americans understand that if our vaccine level drops below 80%, where there are some states that are approaching close to 87, it doesn't take much to keep dropping it. You will not be able to travel abroad as a country without a vaccine record, because other countries who have been vaccinated don't want unvaccinated people to be bringing in things. So we take this all for granted because of this herd immunity, but and they don't care whether you get RSV. That's not what they're looking for. They're looking like, did you get tetanus? Did you get polio? Did you get measles, mumps, and rubella? Those are the ones that they're super worried about. So I guess that's where I am on that.
Well, Dr. Patel, thank you so much for your time and your expertise today. I really appreciate it. For people who might want to come see you, go to Healing Family Functional Medicine. They can visit your website. Do you do any kind of virtual appointments, or do you like to do in person? I know virtual is like really hard unless you know them, but...
Actually, no, I do. The cool thing about functional medicine is most of it can be virtual. There's not much on the physical exam that we're looking for, but virtual is what we're I can do virtual visits. So healingfamilyfunctionalmedicine.com, and then, or they can follow me on Instagram at Seema Patel, MD, MPH. So.
Thank you, Dr. Patel, for inspiring us to look deeper into the roots of our health. Healing isn't just possible, it's transformational when you treat the whole person. I have linked Dr. Patel's information below if you are looking for somebody who is extremely knowledgeable in functional medicine. She does do virtual Zoom meeting appointments, and I can't tell you how hard, I know personally how hard it is to want to make changes for myself to live a healthier lifestyle. I promise you, if you take baby steps, make small changes a little at a time, it is worth it for your health. Until next time, keep asking questions that lead to a healthier you. Be blessed. The information provided on this podcast is for general informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or health concern. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. The views expressed by guests on this podcast are their own and do not necessarily reflect the views of the host or Go Ask a Nurse.